The body has more than 600 lymph nodes in clusters in the neck, armpits, groin and torso, between the lungs, and in the belly, and around the bowels. The lymph nodes scattered throughout the body act to filter out harmful, foreign cells, like viruses and bacteria as well as cancer cells. Lymph nodes are no bigger than a baked bean, but they're powerful weapons in the body's defense against disease and infection. These ovoid glands are scattered throughout the body, helping filter impurities in the blood. Sometimes, you may notice swollen lymph nodes in your neck, armpits, or groin. This is usually a sign that your immune system is producing an abundance of B cells to help your body fight off infection. But swollen lymph nodes may also signal more serious conditions. How do you know if swollen lymph nodes are due to a serious condition? When you have a bacterial or viral infection like a cold, the flu, an ear infection, or an abscessed tooth, your lymphatic system kicks into action, producing lymphocytes to fight the infection and causing the lymph nodes to swell. If you're aware you have an infection like strep throat or an infected cut, for instance, you may recognize that the swollen lymph nodes are related to the infection. Immunizations, including the COVID-19 vaccine, may cause swollen lymph nodes and usually disappear after a few days. Certain medications, like those to prevent malaria, may also cause lymph nodes to swell. You may have swollen lymph nodes and not be able to pinpoint the cause or location of the infection without the help of a doctor, such as in the case of mononucleosis, shingles, a sexually transmitted disease, or an autoimmune condition, such as lupus or rheumatoid arthritis. Sometimes, swollen lymph nodes are a sign of a more serious condition, like cancer. Some characteristics may help distinguish worrisome swollen lymph nodes from those just doing their job defending the body against infection. If you can feel a lymph node that's bigger than a half-inch, or if you can't move it with your finger, that's more worrisome. Also, if it feels firm, that may cause concern. Whenever an adult older than 40 can feel a lymph node in the neck, that's a worrisome sign. Here's how to tell the difference between a normal and abnormal lymph node. A normal lymph node feels like pressing on the tip of your nose. An abnormal lymph node feels harder, like pressing on your chin. When should you call your doctor? Call your doctor if you have any symptoms that concern you. You feel may need medical attention for any reason. You can't think of or discern a reason why your lymph nodes are swollen. Also be aware of other persistent symptoms you may be experiencing along with the swollen lymph nodes, such as fever, chills, night sweats, loss of appetite, unexplained weight loss, non-healing sores in the mouth, ear pain, cough that produces blood, blood-tinged mucus. What cancers are associated with swollen lymph nodes? Cancer of the lymph nodes is called lymphoma, which is a type of blood cancer. Lymphoma is categorized by a number of types, but the most common are Hodgkin lymphoma and non-Hodgkin lymphoma, differentiated by the type of lymphocyte cells involved. Cancer cells found in lymph nodes may also have broken away from another cancer elsewhere in the body and traveled there through the bloodstream or lymphatic system. Most of these stray cancer cells die before they can start growing somewhere else. But if the cells spread to a new organ or lymph node, the cancer is considered metastatic. Metastatic cancers often cause swollen lymph nodes near the tumor, as the body tries to do its job fighting off the disease.